If you're here, it's probably because you're feeling anxious about a dental appointment that's coming up. My goal here is to help you get through that and walk you through steps that'll make the process a whole lot easier. My name is Debbie. I'm a dental hygienist. I've been doing this a long time. My goal is to help you. So come on in. I rather take it away from the dental office into the comfort of our own homes. Let me just say, if you're that person that before you even get to the dental office is stressing over it, and whatever that may look like for you, it could be tension in your jaw, tension in your shoulders, losing sleep. It could be your breathing is different. Let's just have a conversation, shall we? The first step, don't be afraid to tell your dental professional that you do have some sort of dental anxiety. We're here to help you. That is our job. There are measures we take to help you deal with it. In all my years, I have noticed many patients that aren't telling me, but I recognize it and then I do things different. For that person like yourself, what I usually do is I'll explain everything I'm doing before I even start with whatever it is. I also um, maybe take my time and just talk to you, get a little more comfortable before the whole thing starts, right? So as soon as you get in the chair, you just, if you need to, ask to relax a second and don't feel bad about it. If people were more open to talk and tell, I think it would just look a whole lot different for you. So, as I'm watching those signs, if you're not telling us, then I will hopefully pick up on them. And the way, like I was saying, how I deal with it is I explain everything I do. Now, I'm not sure about most offices or how your office works. I'm coming from the what we do in our office. So if it's not done in your office, maybe you can ask for it. But what I generally do is I'll take blood pressure first. And then, not that that's a marker, but the white coat syndrome that we get when we go to the, medical office, see a regular doctor. That can happen in dentistry too. And I might do that. We're reviewing your medical history, going over anything that might have changed, and that should be very thorough. Please don't ever leave anything out when you're going over that with your professional. Oftentimes, I've had done the entire, the appointment, and when the doctor comes in, then the patient says something that wasn't told to me prior to. So everything is important for us to know when we ask about your medical history. But by taking the time for that, that then allows you to feel more relaxed, calm your breathing. Let me get it out. Calm your breathing and just get you into the mode. After we review your medical history, we'll then lay you back. If you need us to go a little slower with that, sometimes we can't because our chairs are automatic. But just get comfortable, move your head, move your shoulders, readjust your body, whatever you have to do before you go into that position. Now we have to lay you back pretty far because we need to see your mouth. And sometimes people get a little freaked out about that. Sometimes they hear, oh, I have vertigo, or I have this, or I have that. So what that tells me is when we bring you back up, we just take your time before you leave the chair. Once you're laid back, so how I help with that anxiety is I will then say, okay, I'm going to do such and such. And usually I start with a intraoral, extraoral cancer screen. That tends to look like, me taking a 2x2, this little gauze, moving your tongue around, having you say, whatever, and then kind of touching your neck a little bit because we have major lymph nodes in our head and neck, and making sure those feel natural, normal, no lumps or bumps. We can also take small pauses if that's not relaxing you at that time. But again, let us know. We'll talk each other through the procedure. So after the initial exam, then we'll start either we do periodontal charting, and that's where we take a little instrument, kind of like think of it like a ruler for your gums, and it has little lines on it that indicate to us in millimeters how deep a pocket is. So we'll take that and we'll go around your mouth. You might hear the hygienist say 3, 2, 3, 4, 5, whatever it may be, but that's what we're doing. We also are looking for any bleeding, any mobility of teeth, any recession of the gum. We're looking for all these things. So as we're doing this, again, if the anxiety hasn't gone away, make sure have your dental hygienist talk to you about it. I usually say what I'm going to do. I'll say, okay, I'm going to do my periodontal charting, which is the 323, and that makes the patient feel better. Hopefully that would make you feel better too. After the periodontal cleaning, the exam, then I might take a camera around your mouth and look and see. But at that time, I will let you know, hey, I got a camera. I want to take some pictures for us to look at, for the doctor to look at. And then after that, we do our cleaning. During the cleaning, if the noise of it or the feeling of it is something that sets you off, let us know. We have many ways to help with the feeling. We can numb your gums. Um, some hygienists will even do, and I don't want to use the word, it might be, scary, but we can give injections to numb the nerve. Then that way, kind of put your tooth to sleep or teeth to sleep. It makes it feel better that way. I generally use topical if you're sensitive. And then if the noise is something that bothers you, feel free to put in earbuds, headphones, whatever you may have to just zone out, the white noise. And we can communicate via hand gesture, or we can pause and then you can, take something off and then we can talk if we need to. But those are little simple things that you could do at the moment. I think I will go in deeper about what you can do at home prior to, as far as anxiety, but as the appointment progresses, or even before it starts, if you're more into something comfy, cozy, you can. Again, this is dependent on your office, but we offer blankets or pillows, weighted blankets, all different things to just help you feel a little more relaxed. That's when you need to ask. If they don't have it, I would say bring it in with you. I mean, trust me, we see it all. Bring it in if that's what makes you feel better. Now, as I'm doing these videos, I'm new at this, guys. Just be patient. But if there is anything that I'm not bringing up or you have a question about, let me know. And I'll do my best to help you out. I think those things that I did mention will offset some of your anxiety, some of your stress. But yeah, I mean, once you settle down, things get better. And then going forward, each time it'll get better and better. Now, it'll also make the cleanings feel a lot shorter in time once your mind settles down, which is helpful too. So if any of this was helpful for you, please leave a comment. And if I'm skipping anything, let me know. I will be more than happy to go into things a little deeper. Going forward, too, I think I want to open up a live on Fridays, probably Friday evenings or Friday afternoons. I haven't come up with the time that we can talk right then and there so that you get your answers taken care of during a live. So if that's something you're looking forward to, just let me know in the comments. And I hope this makes you feel better. And I wish nothing but a healthy and happy visit next time. Bye for now.